welcome back to Rohrich Knows Podcast, helping you become a better and a smarter and more informed you about all things related to plastic surgery and cosmetic surgery and wellness. So let's take a deep dive on Botox and the neuromodulators. What strikes me is that I had a patient comment to me in a follow-up consultation before her facelift, and she said, you know, I'm 60 and Botox won't work on me. My doctor told me it won't work. And I said, what? That's not true. I mean, Botox is not age-related. It's not time-related. It's science-related. So that's why this is Botox for all reasons and all seasons. And I'll give you this guide on how I use it from 30 to 60, from even 20 to 60, just to give you some ideas. So, you know, Botox or neuromodulators over 20 plus years in use for cosmetic use. So it's been used a long time. We've learned a lot about Botox and the neuromodulators, on the pros and cons about that. And I'll show you how I use it and incorporate it in my practice as a patient ages, you know, when you go through from their 20s and 30s to 40s to 50s, and the whole enhancing of the things it can do and the things it can't do. And of course, it's not surgery. It's not it's not a filler. It's a neuromodulator, meaning it partially weakens certain areas of the face to minimize wrinkles, to elevate the brows. And that's why you have to understand facial aging. You have to understand and know the anatomy of the face if you truly want to get it right. So really in the 20s and 30s, if you're going to do it, you know, it's all about rejuvenation, preventing and softening in the glabellar area. So if a patient comes in their 20s or early 30s and if they're beginning to have imprinting of their forehead lines and beginning of lines, you can actually minimize those. I used to not believe that 5-6 years ago. If you start doing micro Botox in these areas, in the glabella and the forehead, even in the crow's feet. So you really want to prevent, rejuvenate and perfect and keep people just looking good, because especially in the forehead, the glabellar lines, and the early crow's feet, this light dosing, and anyway, it's called baby Botox, which really means that you're putting less, you know, maybe less than 25 or 30 units of Botox in this area to maintain a natural expression. And also, if you're a real animator, sometimes you'll really get early. I've seen 20-year-olds with deep frown lines. Those are the patients that really would benefit from a light amount of Botox so that they don't frown and animate so much. So prevention and rejuvenation in your 20s and 30s. And I think that really helps you look good. Now, and sometimes I will do the upper lip if they have a gummy smile, and I'll even do the upper lip flip in patients that have a longer lip or have a non-dynamic upper lip. But I usually reserve that till they're a little later. And of course, you can get a lateral brow lift when you inject the crow's feet. So, but this is also in the time when you're in your 30s and 40s where you can do a filler combo of adding Botox and filler together and give you a nice shape in contouring and not overdoing it. So, but in the 40s, you want to begin to start smoothing and strategize for the future. Well, is this now going to be good enough, or do I need a brow lift? Do I need a blepharoplasty? Because now you're beginning to address wrinkles and skin elasticity. And wrinkles begin to emerge in the forehead and the crow's feet, and you've got to really be able to judge how you treat them. And that's why it is so important to go to a prudent injector that can do total facial balancing with neuromodulators. That's very, very challenging to do. I see patients day after day that come in with asymmetry because of Botox, and they'll say, oh, the Botox didn't work. No, the injector didn't work. It's proximal to the needle. So you've got to go to somebody that understands the face, the big eye, the small eye. One eye is always bigger than the other, and one eyebrow will be higher, one eye will be bigger. You've got to have asymmetry, and you can correct that. You can make that. And it's the same with the smile. You can make that better. You can get rid of the necklines if you're a good injector and know the anatomy. This is where you have to really start customizing their treatments, because they're on the verge of having surgery. So you can mask some of the aging of the neck and of the crow's feet if you smooth and strategize using a neuromodulator. And this is also one where you're probably going to use 50 more units. And you're really balancing and smoothing. So you're going to be, again, you're going to do the crow's feet, and the glabellar frown lines are crow's feet, and then also you can enhance their smile by doing the DAOs, the depressor anguli oris. That'll bring up the corners of their mouth, and also they'll bring up their eyebrows. So then, and every time you're going through one more decade, you have to strategize and become much more refined in your technique. So you have to go to an experienced injector. Just skip the spas that are just having the walkthroughs. You've got to go to someone that really, really understands how the face ages. Because in your 50s and 60s, you're going to refine and you're going to use it as an adjunct to rejuvenation with surgery. So you're going to have people that are going to want, finesse after a brow lift, because you can't correct all the deep wrinkles with a brow lift, but you can soften them with Botox or a neuromodulator, even some residual neck bands and marionette lines. You can enhance your facelift results with doing that. So it's really, really combining this with other treatments. Many times it's with fillers. You're beginning in the 40s, and then you're also going to be doing a lot of this in the early 50s, along with facial rejuvenation. Because in the 20s and 30s, Botox was the primary. And in the 40s and 50s, it becomes more secondary to facial rejuvenation and other adjuncts like fillers and non-invasive techniques. So remember, it begins primary to now it's secondary. And this is when you're going to really go and soften the deep frown lines and the deep crow's feet and the deep lines around the perioral areas, the lip flip. It's all going to be used. And then if they have a really strong masseter, you're going to do the masseter reduction and actually help to streamline the face, because it not only gives you more shaping of your face, but also will correct bruxism in this area. So you're lifting and rejuvenating along with surgical techniques. And then in the 60s, you've had your facelift, and now you're using it as a support and to subtly help along with surgery and fillers to enhance your results. That's what you're doing. And it really, I always tell people that you can use neuromodulators to enhance your surgical post-op result. And that's a good thing, especially, the downturned mouth and the fine lines, especially if their lasers were not deep enough to correct their fine lines. You can use Botox to help supplement that. And here's where you begin to use lower dose Botox to preserve muscle tone and natural appearance. You don't want to power up like you did in your 30s. So you want to really, not only, so you're going from primary to secondary to supportive role of Botox. And those are the key landmarks here. And you're using less and less Botox. So the key is you want to continue to have a patient look refreshed and rejuvenated, because now they've had surgery, they've had fillers, and now it's time to just use it as a supplement and support. So I hope this has helped you understand that it's not just about a pattern of Botox that you put in and you get the result. That is totally the wrong thing to do. It's really how you approach the patient as they age, and how you use Botox from the prejuvenation, where you're using a lower dose, to a more moderate dose in the 30s and 40s, to a lower dose in the 50s and 60s, kind of the bell-shaped curve. So that's called the art of neuromodulator along the sliding scale of aging. So hopefully this helped you understand that Botox is truly for a lot of people, not necessarily for everyone, but for a lot of people. So know before you go, find a superior injector that understands the science of aging, and you'll do amazing. Till next time.